Hi, Nursing 2050, Section 7, Group B. I'm here to give a presentation on your assignments. So today we'll be reviewing the assignments today. There's assignment 1, assignment 2. There's your midterm reflection, a final reflection. There's your geriatric model. And your geriatric model 2, okay? So for assignment 1, you'll be starting it next week. Please bring in your assignment 1 packet so you can fill out, and also bring in your assignment 2 packet so we can start talking about it. Assignment 1 will be due October 20th. And assignment 2 will be due November 3rd. So midterm reflection is due November 3rd also. Assignment 2 is due November 17th.
Is that the final reflection?
The assignment, assignment 2 is due November 3rd.
Okay.
The assessment, the head to toe assessment is due November 17th. Your final reflection is due on your final day of clinical. Now let me know when you guys are ready. Everybody got the dates down?
Mm-hmm.
I'll send an email out about the dates for further reminder. And so for the midterm reflection, there'll be a sheet of questions that you're asked to answer and hand in. You just have to go on Canvas and download the sheets. That's for the midterm reflection and the final reflection. And the head to toe assessment, there's a checkoff list that you can download on Canvas. Just follow the sheet verbatim to complete your head to toe assessment, and then you'll receive a complete points for it, okay?
Mm-hmm.
As far as the geriatric module 1 and 2, both geriatric module must be completed, but there's no due date. As long as you complete it before the semester ends. So for today's objective, I will be reviewing the assignment. After reviewing the assignment, you guys will be able to identify the due dates, which I just mentioned. And after reviewing the assignment 1, you'll be able to differentiate between subjective and objective. And after reviewing assignment 1 again, you'll be able to list and recite 5 body systems that you're going to be assessing next week. So let's move on to assignment 1. So I gave you guys a handout. It's this one.
The big one?
The big packet, guys. The big assignment. This is just an example, but I'll be reviewing what we need to go through next week, okay? So, as you can see, there is a pathophysiology section, a demographics section. You don't need to write that down, okay? There's a demographics section, there's a general survey section, there's a health maintenance section, a nutrition section, elimination section, a sleep and rest section, activity exercise, cognitive perceptual section, self-perception, self-concept, a role relationship section, sexual reproduction, stress coping, values and beliefs, lab values, and diagnostics, medication section. So this is what next week's assignment is about. So as I move on to first part of the assignment. This part of the assignment right here is your pathophys. Your pathophys starts off with medication diagnosis and definition. So you look up, you'll be assigned a patient, and they'll have a diagnosis there, right? And so this is when you go home, you look up the definition of the medical diagnosis. 2 points will be received for doing so. And then you have your signs and symptoms. On the left side is your typical presentation. On your right side is your patient's presentation. So the left side is talking about you pull from the book, and on the right side is what you see during clinicals. So please fill out the right side when you're in clinicals tomorrow. Next time I see you, okay? Mm-hmm. So there's signs and symptoms. 2 points will be received for filling it out for both sides. Your etiology and risk factors are 2 points too. Etiology is talking about causes of the disease. And then last is treatment and diagnosis. So what kind of treatment will help the patient cure the disease or treat the symptoms of the disease? Diagnostics are like imaging, EKGs, or the different types of tests that will be done for the patient. The next section is health maintenance, health perception. This is talking about what does the patient do to maintain their health. Do they drink alcohol? Do they smoke? Do they wear a seatbelt? Do they own a gun? Do they store the gun in the correct location? Is there a smoke detector at home? Is there a supplement or self-test? Is there alternative therapy available for the patient? Is the patient's health poor, fair, or good? That's for this section, guys. Mm-hmm. And then the next section would be subjective, metabolic, and skin wound. This is talking about the usual diets, the food intake. So are they on a regular diet, cardiac diet? How's their appetite? Are they eating everything on their plate, or are they not touching their food? Do they have, what's their height and weight? Are they gaining a lot of weight, or are they losing a lot of weight really fast? Is there nausea or vomiting or any discomfort? Do they have a hard time swallowing? And are they on supplemental feeding or IV therapy solution? Some of you saw some IV therapy today, like normal saline or dextrose that was hung, right? Mm-hmm. Also, you guys also saw some lactate ringers. So this is where you put it in for this section. You check for the skin status. Do they have any discoloration, wounds, cuts, any pressure injury? You put it on this section too. And do they have any CBG results or fluid in their extremities? That's called edema. So when you're filling out this paper, there's subjective and objective. Subjective is when what the patient tells you, versus objective is what you see on the patient and what you get from the imaging. That's all objective data. So the next section is elimination. So again, every section has a subjective and objective. And you go through the bowel pattern. So which one of you saw the nurse listening to the abdomen today for the patient? One of you guys, right?
We had a bladder scan.
Well, one of the was it Ashley, the male nurse, was listening to the abdomen today. He was auscultating the bowels, and then he asked, "When's your last bowel movement?" So this is part of the assessment that you do. So are there bowel sounds? When's the last bowel movement? What's the character? Is it watery? Is it formed? And if there's bowel sounds in all four quadrants, okay? Is the person in any pain? One of the patient had bowel obstruction, so if you touch that area, it would be tender. So you would like to put that in this section too. And any medication and if you see any ostomy bags in the abdomen, you record it on to this section. You also talk about the bladder. Are they peeing a lot? Are they what's their color? What's their amount? If there's an odor, usually if there's a foul odor, it's usually a UTI infection. They would like to get a lab test for it. So make sure you jot all those things down. So this is why it's important when I tell you to look underneath the bed if they have a Foley catheter. Right there and then you can see the color of the urine. And then if they're on any dialysis medication. So the sleep section is talking about how well the person's sleeping, what's their rest pattern like. Are they sleeping completely? Are they sleeping for 8 hours? Or are they only sleeping for like 1 hour, waking up, having a hard time falling asleep, and then going back to sleep? If there's any method of sleep, are they using a machine to help them sleep? Some people have sleep apnea, so they use a CPAP machine. Some people have a sleep disorder, and so you pretty much want to ask that question to the patient. So for this assignment, you can also ask questions to the patient to get information out of them. For the cardiovascular assessment section, you want to check their pulse. If there's a +2, or if it's a +3, or if it's diminished, +1. You also want to check their heart sound. I know in Skills Lab you check all 4 places for your heart sound. Just only check for the apical, okay? And for the ECG rhythm strips, I'll show you later where to get the ECG rhythm strips. It's usually in a patient's binder right next to the patient's room. You can take a look at their ECG strips if they have any. You also want to note if there's any calf tenderness, any bruise available, and check for the capillary refill. How many of you guys know what a capillary refill is? Go ahead.
You press the finger until it's white.
Yeah, you press on the bed.
Nail. And then normal should be less than 2 seconds, right?
Less than 3, yeah.
Less than 3, okay.
Correct. And And after checking for capillary flow, you also want to check for edema, any fluid in their extremities, any exercise issues. So all of us can run like a mile, right? Well, let's say we all can, right? But some patients can't even get up and walk. So, so that's usually exercise. Their activity is per tolerance. It's based on what they can do. And as nurses, we want to encourage them to move as much as they can. We also want to check for intermittent claudications, any use of TED hoses, check for their blood pressure, pulse, and temperature, and if they're sweating. So as for the blood pressure, I'm not sure. Do we have them get the machine blood pressure or manual blood pressure?
Probably the machine next week. It'll be reality of being here, yeah.
Okay, so the machine blood pressure would get your pulse and would also get your blood pressure. So for the respiratory assessment, you want to see if the patient's on any oxygen. Usually they have something on their face or on their nose. That's called a nasal cannula. And if they're on it, you want to check how many liters of oxygen they're using. It is best to do so, and also check for their breath sounds. And if it's symmetrical breathing, if their chest is rising, or if they're having shallow breathing, you want to record that right here. And you want to ask them if they can cough for you. Sometimes it's a dry cough or wet cough. You want to be able to note what kind of cough they have. If they're in any shortness of breath, or if they're using accessory muscles trying to breathe. Some people have a hard time breathing, and you can see they're actively trying to breathe. They're using all their energy just to learn how to breathe. So that's called using accessory muscles and overexertion. You also want to check for any chest tubes. That's why I also mentioned to you guys, when you walk into a patient's room, you want to check below the bed rail to see if there's any catheters and any chest tubes. The chest tube machine will be on the floor. And then you want to look at their trachea too, and their respiratory rate. So for the ADL mobility section, there is a table for you guys to fill out right here. The table here talks about numerical numbering system. 0 is total dependence, 1 is assisted device with a person, 2 is with assisted device, 3 is total independence. So you want to ask them how they're able to eat, how are they able to bathe or dress themselves at home and also at the hospital. The numbers can be different if they're here or if they're at home. So make sure you ask those questions. So you also want to look at their ability to perform their daily activities. Are they able to get up and use the restroom? Are they able to set their own tray up and eat? And if there's any issues with moving, that's mobility limitations. If they need assistance, if they need a caregiver, if they need one of you guys to help them get up to use the restroom, you want to put that down. Assisted with 1 person, or assisted with 2 person, or standby assistance. And you want to see if they can move on their own. That's called ambulation. And as I said before, activity tolerance, how much they can move on their own. You also want to check for range of motion. Range of motion, there's active and passive. Well, do any of you guys know what active and passive range of motion is? You?
Is active when you're not going against resistance?
Active is when they're
Or
moving
when
by
you are
themselves.
going- Okay.
Yeah, when they're moving by themselves, that's active. When they can't move and when you have to help them move. Can I use you as an example?
Yep.
Come here. Alright, so this is passive. I'm helping her move her arm, okay? Please sit back down.
Good to know.
And last section for the ADL and mobility status is the fall risk score. So Henry Ford uses the Morse fall risk score. You just have to go on Epic and look up their fall risk score under the head to toe assessment, okay? So for the cognitive perception section, there is a reflex and neural section and a sensorium section. So the reflex and neural assessment is you want to check on their reflexes. You also want to check on the pupils. Now Jonah has a light here that you can use for the pupil reaction, but it is recommended that you bring your own light pen. Okay. So you assess if there's any accommodation in their eyes. You want to check for their hand grip. If they can grip your fingers, can you grip my finger? That's a hand grip test. So if they can grip firmly, it's a +2. If they can't, it's a +1 or 0. And please don't check their gag reflexes. We don't want them to choke every time. We want their hospital stay to be as enjoyable as possible. And you can easily check for their swallow by asking them to drink a cup of water for you, okay? And also check if they're on fluid restrictions. If they're on fluid restrictions, have them drink 1 gulp of water, but you have to record that. And also, make sure you check with your nurse if they are on fluid restrictions. We don't want to not follow any rules here. The next is the sensorium section. You want to check for their vision, hearing, touch, smell, vibration, dizziness. Basically, they're HEEMT. So, eyes, nose, ears, smell, right? You want to make sure that they can do all these things. So, example is people with COVID, they lost their sense of smell or taste. This is where you put this down. But we're not gonna treat any COVID patients here. We want you guys to be safe, okay? The next section is the pain section. So there's a subjective and objective part of pain. So whatever you ask about the pain, old cards. Do any of you guys know what old cards is, or
We use
cold spa, right? So use cold spa on the patient to identify the location, the intensity, the character, the duration of pain, anything that can worsen or relieve the pain, and any other associations, okay? And their last dose of pain medication is also recorded here. So for the cognition, you want to see if they are English speakers, if that's their native language, or if they speak another language. Sometimes they speak another language. Suppose if a person comes in and speaks Spanish only, that's their native language, they may need an interpreter. So it is best to write that down in this section. This is also pertaining to barriers in teaching. If they speak a foreign language, we can't really teach them properly. So that's a barrier. And to overcome the barrier, we call the interpreter on the line to talk to them. Any speech deficits, any orientation, and highest level education. So most of you are you guys second degree?
Mm-hmm.
So your highest level of education is a bachelor's in whatever colleges you were at, right? So you want to write that down in that section. Now there's a self-perception and concept section. This is where the developmental level is, the goal barriers to achieve the goals, and changes related to hospitalization and nonverbal behaviors. So, like barriers to teaching, you have barriers to reach your goal. Suppose the patient's not able to move 50 feet. What's the barrier? Can some of you tell me some of the barriers of getting a patient to move 50 feet are? Anybody?
Motivation.
Motivation. Some people may be lazy, right? Any of you guys?
Maybe they feel short of breath.
Short of breath, right? Pain is also one too, right? So if they lack the motivation, we've got to be on them. They are short of breath. Maybe they need oxygen while they move, right? And for pain medication, maybe they need a pain medication to help with their pain an hour before they start to move. So for the roles and relationships section, this is talking about household living arrangements, their relationship with their family, their support system, their ability to pay for medication is very important, and then Medicare. So some people here have a hard time paying for the medication, and we have to make sure we find out early on, so we don't give them like a really expensive medication. We can find out some other resources available to provide the necessary treatment that they deserve. So usually the social worker will help us with this section too. So it's also good to check out on Epic if the social worker put anything about financial issues on the medication. So the next section is sexuality and reproduction. This is a sensitive topic to talk about, and when you guys are talking to the patient, please make sure that you are aware of the situation. Be polite about it, and go about asking them, hi, I know this topic may be a little bit sensitive to you. We have some questions for you. If you feel uncomfortable answering the questions, please kindly decline, and we can move on to the next section. So you want to ask for the menstrual period. You want to ask for their birth control if they're on any. Stuff that's sensitive are like sexual activity, the sexual preference, the sexual concerns. So please be sensitive about that. Also ask about their self-breast exam, if they perform a routine self-breast exam on themselves. And for males, if they have a testicular exam that's done routinely. You also want to look for any discharge, any spotting when they're on their periods, and any discharges. Discharges like if they contract a sexually transmitted disease, they could have some possible discharge in the private region. That's also a very sensitive topic to go over with the patient. So the next section is stress coping. So we all are really stressed. From 1 to 10, 10 being stressed with nursing school, how would you guys rate this program?
11.
11, right? So with those stressful events, it's good to have good technique, good ways to relax. It's the same way. You guys are going through a lot of stressful events in your life. You guys have time to do your favorite hobbies or to watch something on TV like Netflix to help cope with your stress. You want to ask your patients the same thing. How do you cope with your stress? What are your hobbies? This could help them open up, and this could help you understand if they are able to manage their stress properly. And then you also want to ask if their stress management hobbies and stuff are effective ways to deal with their stress, and if they have a good support system. So I'm sure many of you guys have a good support system at home, whether it's your family, whether it's your sibling or significant other that helps you support mentally and physically support you through this program. So you want to ask your patients the same way, okay? So the next is values and beliefs. This is also a sensitive topic. Some people don't really want to disclose what their values and beliefs are. So again, with the reproduction system, when you assess, please be cautious, and please tell them, hey, if you don't feel comfortable answering this, you can kindly decline. But you want to ask for their spiritual belief, their cultural beliefs, if they need a spiritual consult. With hospitalization, is their spiritual and cultural beliefs interfered? And we want to see what we can do to help them out. There's a chaplain here at this hospital that comes over to help out with their spiritual belief. So it's good to ask them, because if you don't ask, they'll just sit there and say, hey, I'm not meeting my daily or routine spiritual belief. But if you offer, be like, hey, have you seen a chaplain today? Would you like to see one? That'd be really grateful for them, for you guys. So the next two sections are your medication and diagnosis. So your diagnostic test, you want to include several diagnostic tests. If the patient has an imaging done or CT done, you want to put that on here. You want to also look at your x-ray. If it's on here, you want to note the test being performed, what are the normal findings, and what are the patient's results, and what is the reason for the test. So one of the patients here has a pneumonia, right? So what kind of test would you guys order?
X-ray.
So what's your reason for the x-ray?
Look for fluid.
Fluid buildup in the lungs. So for the possible reason of results abnormal, put down pneumonia, fluid buildup in the lungs. For example, if the person is in a car accident, you want to do a CT or MRI scan of their face. You put that down. The patient wasn't involved in a car accident. The next section is your medications section. We require you guys to have at least 5 medications for the patient. So you want to put down the generic name. We like to use a generic name. We don't want you guys to use a brand name. You guys are still learning about medications, the class, and the usual dose. So what we mean by class is if the person's on a beta blocker, metoprolol, That's a beta blocker, right? The beta blocker is a class, so put that down. If the patient's on catapress, the class is your alpha, right? That's to help with your blood pressure. And so this is where it comes. This is where it's important: the patient's dose, route, and frequency. So the dose could be 500 milligram or 250 milligram. We would like you to put that down. And as far as the route, it could be oral, IV, subcutaneous, or intramuscular. Please don't abbreviate in this section. We know that a lot of nurses do, but for being a student nurse, let's not abbreviate here, okay? And for frequency, it's like 3 times a day, 2 times a day, or as needed, or every 6 hours. You put that down. And reason the patient is on the drug. Reason the patient is receiving the drug. Is the drug used for blood pressure, or is the drug used for asthma? Right? What is the reason for the drug? For nursing implications, any assessments that you guys do. So before giving a blood pressure medication, what do you guys do?
Check the blood pressure.
Check the blood pressure. So you have to write down the blood pressure before administering the medication. Or before giving a breathing treatment like albuterol, what do you do?
Check the O2 saturation.
Check the breath sounds, right?
Oh yeah.
So these are the assessments to be expected. Write some common side effects down. I'll show you later on in EPIC where to find the side effects for the medication. And if you guys don't remember, you guys can come to us for help, and we'll be glad to help. You know, because EPIC can be a little bit confusing, but we're here to help develop your skills as a nurse and any teachings. So some medication requires a full glass of water before taking the medication, or some medication requires you to have your meal while taking your medication. Any labs. So one of you guys have a high or low potassium, and you guys administer potassium or potassium wasting medication, because that's important to check the labs. You don't want to blindly give the medication. Check the labs. If they're abnormal, then you give the medication. Or remember, if the medication is a blood pressure medication, we said check the blood pressure, right? Don't just check the blood pressure and just give the medication. You have to critically think, oh, the blood pressure, is that normal or is it too low? If the blood pressure is low, you want to hold the blood pressure med. These are things that we'll go through when you guys are administering medication. And last is how effective the medication is. Did it lower the blood pressure, or the patient's in pain? Is their pain fully relieved, or is it mildly relieved? And by the way, back to the pain section. Not everything's about pain medication. Remember to ask if they would like a cold compress or a heated compress. Just not too long ago, last night, one of my patients was in a lot of pain, and she just jumped on, hey, I want a Norco. I told her, hey, let's try a cold compress. And within 1 hour later, she didn't really need the Norco. She said, oh, I feel a lot better now. Well, that concludes my presentation for today. If you guys have any questions, let me know. I have a speech evaluation for you guys to fill out and a quiz to fill out. Please let me know what you guys think, okay?
Okay.
Thank you.